Hey everyone, welcome to Medication Monday. This is where we go over a different EMT drug that we administer out in the field. We do it specifically in EMT drug card format. As always, follow your local protocol and scope of practice. Enjoy. Today's medication is called acetylcysteine, and acetylcysteine is also known by its brand name, which is Acetadote or Acetadote. I've heard it both ways. So acetylcysteine falls under the class of antidotes and mucolytics, but we are not going to be going over the mucolytic indication, just the antidote indication. So your mechanism of action is that it decreases the accumulation of the hepatotoxic metabolite in acetaminophen overdoses. Your indications are going to be acetaminophen overdoses. And before we get into dosages, as always, please abide by your local protocol and scope of practice. Your initial dose is going to be 150 milligrams per kilogram, a max of 15 grams over 1 hour. And your maintenance dose, your first maintenance dose, will be 50 milligrams per kilogram, a max of 5 grams over 4 hours. The second maintenance dose will be 100 milligrams per kilogram, max 10 grams over 16 hours. So typically, we won't see a whole lot of the maintenance doses because in EMS, you don't really see acetylcysteine on the ambulance themselves, but you may actually see it used during long interfacility transports that are for the purpose of higher level of care. Your contraindications of acetylcysteine are going to be hypersensitivity and acute asthma. Adverse reactions are drowsiness, vasodilation, and allergic reactions, and specifically allergic reactions including anaphylaxis and angioedema. Acetylcysteine, the one that we're going over specifically today, is given through the IV, and so something that they do run into a little bit is allergic reactions. So that's something that we have to monitor and make sure that we don't see signs of, and if we do, obviously treat it as you would an allergic reaction. How it's supplied. It is supplied in a 6 gram and 30 ml vial, and this actually has to be diluted. Your drug interactions. Activated charcoal may adhere to any acetylcysteine that is taken orally, and it will decrease its overall effectiveness. A few side notes about acetylcysteine. Be sure to administer within 8 to 10 hours of ingestion, and this is for the IV route, or 24 hours for the PO route. And like I said, most ambulances won't have either one, and the one that you will see during interfacility transports or what have you, you're typically going to see IV. Onset is going to be 5 to 10 minutes through the IV, or 30 to 60 minutes PO. This medication can be given PO, like I explained, but it typically isn't in the EMS setting. And this medication actually also has a respiratory indication that I mentioned at the very beginning of the video, but once again, typically we do not give this in the EMS setting for the respiratory indication. As always, guys, please remember to abide by your local protocol and scope of practice. This is purely informational for those in the EMS field and never meant to be used in the place of professional medical advice, local protocol, or formal education. Thank you guys so much for watching, and I will see you next Monday. Bye!